Hello everyone, and welcome to our educational video on hand expression, breast massage, and breastfeeding. Whether you're a new mom, a seasoned parent, or someone supporting a breastfeeding mother, this video is designed to provide you with essential techniques and tips to make your breastfeeding journey smoother and more successful. Let's dive in. Hand expression. Hand expression is a valuable skill for breastfeeding mothers. It can help you relieve engorgement, collect milk for later use, and stimulate milk production. Here's how you can do it. Preparation. Start by washing your hands thoroughly. Find a comfortable and quiet place where you can relax. Positioning. Place your thumb on top of your breast and your fingers underneath, forming a C shape. Expression technique. Gently press your thumb and fingers towards your chest wall, then compress them together and roll your fingers forward towards the nipple. Avoid squeezing the nipple directly. Repeat this motion rhythmically, moving your hand around your breast to express milk from all areas. Collection. Use a clean container to collect the expressed milk. Hand expression can take a little practice, so be patient and gentle with yourself. Breast massage. Breast massage can complement hand expression in breastfeeding, helping to stimulate milk flow and reduce engorgement. Here's a simple technique: warm-up. Start with warm compresses on your breasts to promote relaxation and milk flow. Gentle massaging. Using your fingertips, gently massage your breast in a circular motion, starting from the outer areas and moving towards the nipple. Pressure points. Apply gentle pressure on areas that feel firm or tender to help release any blocked ducts. Combination. You can combine breast massage with hand expression by massaging one breast while expressing from the other. Breastfeeding tips. Breastfeeding can be a beautiful bonding experience, but it can also come with challenges. Here are some tips to make it more comfortable and effective. Proper latch. Ensure your baby has a good latch. The baby's mouth should cover both the nipple and a large portion of the areola. You should feel a gentle tugging but not pain. Comfortable positioning. Find a breastfeeding position that works for you and your baby. Common positions include cradle hold, football hold, and side lying. Feeding cues. Learn to recognize your baby's hunger cues, such as rooting, sucking on fingers, or making sucking noises. Hydration and nutrition. Stay well hydrated and maintain a balanced diet to support your milk production. Seek support. Don't hesitate to seek help from lactation consultants or breastfeeding support groups if you encounter difficulties. Conclusion. Thank you for joining us today. We hope this video has provided you with helpful information on hand expression, breast massage, and breastfeeding. Remember, every mother's journey is unique, and it's okay to seek support and take it one step at a time. Happy breastfeeding! If you found this video helpful, please like, subscribe, and share it with others who might benefit. Leave any questions or comments below, and we'll be happy to help. See you next time.